Good morning. I'm glad things are already getting going here, and I'm very pleased to be with you and with my colleague Geeta to open this pre-summit on enhancing child survival and development by achieving population-level behavior change. I want to thank UNICEF for hosting the meeting, and I would like to really acknowledge also Elizabeth Fox and my team for working on this. It's been a lot of preparation, so I'm very happy. You have come from many places, of course, to wrestle with this thorny question of the scientific evidence and its application to development. We all know communications is important. We know behavior is important. Being in Washington, I get to appreciate even more the importance of communications. But at the same time, we don't forget our roots in science, and we need to make the case when it comes to investment in communication and behavioral change for development. A key part of USAID's reform under President Obama administration is a renewed emphasis on the application of research and evaluation to inform strategic thinking about our work in development. And we are thrilled by the President of the Union this week, and many of you heard, for the first time devoting a section to global development, poverty alleviation, as well as ending preventable child death and an AIDS-free generation. In order for us to really move in this space, in 2010, USAID began hosting a series of evidence summits. The purpose of these summits was to deliberately bring together the academic community and the community of development practitioners around particular challenges. What distinguishes these summits from traditional conferences is their focus on mutual exchange and actionable outcomes between these two communities. We are going to be following up on the results of these exchanges. The purpose is to provide evidence-based guidance on how we can achieve some of the world's most difficult development goals, such as what hinders broad-based economic growth, what makes community health workers do better, can financial incentives improve maternal health. We are indeed dealing with some of those. Last June, when we launched the call to action with UNICEF and others to end preventable child death, we knew we had a winner as a way to move forward. We also knew we had many challenges. The idea with the call to action is not to have zero deaths, which are almost impossible even in the richer countries, but we can see the world as a whole bringing down child mortality to the levels of OECD countries, and that can be done in a generation. That is, going for less than 20 per thousand under 5 deaths by the year 2035. The field of child health and development consists of a series of proven interventions, scientifically proven. We know things work. The challenge, of course, is human nature, to mobilize demand and to make sure that we actually can scale up those interventions that are not widely used. We know that that's indeed the task for us. The call to action was a critical, catalytic event to highlight the important strides in child survival and the need to capitalize on the social and scientific advances of the past 2 decades. It emphasized the imperative to deliver on the long-standing premises from the World Summit of for Children and the Millennium Development Goals to give every child the best possible start in life. The governments of Ethiopia, India, the United States, in collaboration with UNICEF, convened more than 700 representatives from government, civil society, private sector, from more than 80 countries to renew their global commitment to ending preventable child deaths. The two-day meeting that many of you participated in demonstrated that an important milestone toward the goal of ending preventable child deaths could be achieved if countries lowered their mortality, as I said, to less than 20 or fewer deaths per thousand by 2035. On the heels of this event, exciting pledges and partnerships have emerged that have led to a promise renewed, led by UNICEF, to help end preventable child deaths. Today, they keep growing, the number of signatories, but more than 166 governments, nearly 200 civil, 172, nearly 200 civil society organizations, over 200 faith-based organizations. Everybody's committing to the idea that we can end preventable child death, that this generation, our generation, can deliver that accomplishment for civilization. 30 years ago, good science and sound research paved the way for the first child survival revolution with oral rehydration therapy, new vaccines, and other innovations at the time. We still have a way to go there, but we have new ideas as well. Today, a promise renewed builds on this science and adds more interventions, coming out of research on new mobile technologies, new vaccines, new devices, the efforts for neonatal, the newborn as a new focus for us, others coming from new ways to organize, deliver, and finance services to ensure quality as part of the health system's strengthening efforts. One area of science that was singled out by the call to action as needing special attention was indeed to achieve population-level behavior change. I don't need to tell you the importance of this area. This call for sound evidence and for policy and program guidance for population-level behavior change is being echoed in other forums as well. The UN Commission on Life-Saving Commodities for Women and Children, for example, is looking for ways to change behavior on the demand side. We know it's not only about having good ideas or even having the money and the products. We have finally learned that having the right tool and interventions alone will not bring about change, and oftentimes the scale-up part and the science of the scale-up, the implementation science as we call it, is not recognized, is not well systematized. Culture, values, norms, beliefs, communities, and behaviors do matter, and I know that you all work in this space with some good ideas and sometimes with frustrating challenges, and that this is the area of science that concerns you, and your contributions to ending preventable child death is indeed what this meeting is about. That is why you have begun to work already on the Evidence Summit on Enhancing Child Survival and Development in lower and middle income countries by achieving population-level behavioral change. It's a long title, and they didn't allow me to shorten it, so that's it. It's quite a mouthful. But the work that you're undertaking is going to be even more ambitious, and I hope that in the end we do come with a few very concrete ways forward. Your systematic sorting, weighing, and examining of the evidence, both peer-reviewed and great literature, along with your own experiences and practical knowledge, will help us as a community determine the difference between what we know and what we think we know, and what works and what we think that works. It's actually quite challenging in terms of, because we love what we do, and then sometimes the evidence doesn't back us up, or just simply the evidence is not there. It's going to be challenging. I'm sure that you will find out today and tomorrow. We all sense the greater consensus is needed on the standards of evidence proper for this field in order to move it forward. It's oftentimes, and I come from the biomedical space, and we have methodologies and robust investments and systems and so on. We want the equivalent also for this important field in development. And that is where you all come in. I'm very happy to see many friends and many colleagues also from our development enterprise here. So we need to put to bed the old debate, because believe me, it's an issue for us in Washington. Does it work? And clearly we need your help to make sure we know it works. We just need to make sure that we can point out what are the things that actually works best, and to have the compelling evidence so we can indeed show that to many others. We need to make sure that these areas remain well supported and investments is paramount. So I would like to just thank you all for joining us in this effort and for your contributions to ending preventable child deaths and maternal mortality, and to ensuring healthy childhood development as well. Thank you very much. Geeta.
Good morning to all of you. It's a true pleasure to be here today, particularly because I'm here with Ariel. I feel like we're in a traveling caravan across the globe, making sure that we keep moving ahead on this agenda that we share with USAID. It's a common vision, and we're really grateful for the close collaboration in this effort to end preventable child deaths and maternal deaths around the world. It's an impressive group of individuals in this room. I happened to look through the list of participants, and I feel very envious, I should tell you up front, because I wish I could participate in all of the deliberations that you have. This was very much a part of my technical work over the years. And you know, my background in psychology and the work that I was engaged in on HIV and the structural determinants of behavior change are all what you're going to discuss today. So I look forward to hearing the outcomes from this meeting. I know you've traveled long distances, so really, really grateful to you and to our colleagues in USAID, particularly Elizabeth Fox, for making this happen. As Ariel said, we have put in motion this global movement, is what we hope it'll become, called A Promise Renewed, a commitment to child survival, which of course cannot happen without a commitment to maternal health and survival. And what we really need now in order to meet the goals of that commitment is the evidence-based interventions that we know we must invest in order to bring about the changes that we are seeking. And a big piece of that is the behavioral and the societal changes, the structural shifts that we need in order to sustain what the medical community, the public health community can put in place. So your discussions could not be more relevant and timely. As Ariel said, we were all cheering at our TV sets when we heard President Obama mention ending preventable child deaths. We shared a clip of it with our global management team. Yesterday, we were in the middle of, all of our regional directors were in town, and just to say that this is no longer just talk. There are countries that have pledged 172 to do something about this, and we really must capitalize on the scientific advances of the past 2 decades to deliver results against this promise. So we have the political commitment. We know we have the high-impact interventions in public health, nutrition, water and sanitation, in HIV. What we held back, I mean, we have the commodities. There's a whole other effort to make sure that life-saving commodities are now more readily available and accessible to the communities who need it most. But it's this issue that you're dealing with, which is how do you get the demand side of the equation, the behavior change to occur? What kind of structural shifts and changes do we need to put in place? And how can we do that? What do we know works? So I echo Ariel's request to not lean back on what we are most comfortable doing just because we've always done it and we think it works, but to truly examine the evidence to see whether we know it works, and then think about how to scale that up. As you all probably know, UNICEF in a previous iteration in the late 80s, early 90s, under the leadership of Jim Grant, had put in place a global movement for child survival, which achieved incredible results, but they were not sustained. So my visit to India, it was shocking to see how breastfeeding has dropped. Immunization rates, how low they are. We had reached 80, 90% coverage in immunization, and then we couldn't sustain it. It didn't go back to where it used to be. In India, when I was there, it was like 20 to 30% in some states. It's come up way beyond that, but it isn't where we had brought it up to. And I'm firmly convinced that we are not going to be able to sustain it unless we bring about the structural shifts in some of those root causes of child ill health and maternal ill health, which is gender inequality, poverty, how do we get, and the systems that are in place. So it's not just, the only point I wanted to make to interject into your discussions, it's not just, as we know, but it is about individual behavior change, but individual behaviors are sustained because of norms, because of social institutions, because of attitudes, etc. But it's also about institutional change. How do we get hospitals to do things differently? How do we get the pediatric associations to do things differently? So it is, it's about behavior change at many different levels, is what I wanted to sort of say to you, because without that, we're not going to move forward. In India, UNICEF had this baby-friendly hospital, like stamp of good housekeeping that they'd give hospitals if they encouraged breastfeeding, ensured that children got the immunization, etc. We no longer do that. And yet I'm hearing that the hospitals actually send babies home with breast milk substitutes. Don't put the baby to the breast immediately after delivery. Why is that? How did that shift? How do we get that to change? So in addition to figuring out what are the ways in which we can intervene to bring about that individual behavior change and that institutional change within hospitals and other intersecting institutions, I also think what we need is a social movement. We need activism. We need populations and citizens to demand that their children and mothers survive. So part of the Promise Renewed activity that UNICEF is now actively engaged in through our country offices is to seed social movements, to build on movements that already exist, and to, there's a lot of health activists, there's women's activists. How can we encourage them to keep an eye, to hold governments accountable, to make sure that they're demanding a right to health? So there's also that component of it, and anything that you can contribute towards, how can we get individuals not only to change their own behavior, but to become proponent and activists to sort of encourage societies to change. It's a tall order, but I'll put it out there, would also be extremely useful. So you will be discussing the social determinants of child and maternal health and how we can equip communities and individuals with the self-efficacy, with the collective efficacy to make the change happen. So I look forward to hearing the results. Just keep in mind, while you look at the evidence and steep yourselves in the research, keep in mind what this is all for. It's got a very relevant, timely, much-needed practical application. And we will find the investment, I guarantee you, to put those interventions in place once you tell us which ones work. So we can make it happen. There is the right political commitment now, the resources we will find. We will scale those interventions up. Your task is to tell us which ones work and what is needed to put them in place. So it's a huge task, and I know this is a pre-summit, but there's a lot of energy in the room, a lot of expertise and experience in the room. There are researchers and practitioners here. So I think the exchange is going to be really rich and I hope extremely productive. Thank you very, very much, and welcome to all of you.
Thank you very much, Ariel.